Everyone, and thank you all for coming to this press event that we have called at this most critical time. There's so much going on, but the big news is that our children are entering school, and no one uh, wants our children to be safe and in-person school more than those of us who are on this call right now. However, we are questioning the legality or the procedures and the legislation that is being used to coerce our children into school, and that's trying to remove the powers from the Department of Health and Human Services to determine the safety of our schools. And so, with that in mind, I just want to make sure that everyone is aware that in late December, it was Donald Trump was yet in office that Michigan received nearly $1.8 billion dollars to help schools all over the state of Michigan to address their dire needs and to get their schools up to par, as well as other mitigation tools that they could put in place and other needs that they had as a result of COVID. Though we received that $1.8 billion, we are here 3 months later, and those funds have still not been fully allocated and relinquished and hit the classrooms, hit our school districts. And this is at a time again when there is a critical need for these funds. But our legislature has chosen to hold these funds up and force some of our children to be back in school buildings. This is all while our positivity rates are soaring. Our COVID case rate has soared to one of the highest in the nation. And this is after we had made remarkable strides that we have now found ourselves back at the top of the list for our case rates. Our rates are 300 times higher at this time today than we were this time last month. Our hospitalization rates have increased. Between March 1st and 23rd, we've seen the hospitalization rates increase 633% for adults 30 to 39, 800% for adults 40 to 49, and then our adults 80 and up 37%. It's an increase, and it's good that it's not as high as the others, but it is an increase. And when you look at those age ranges, those are age ranges of parents of children. We also know that we're seeing the B117 variant that is ranked, Michigan is ranked the second highest for the cases that have been found in the nation. And we know that that is one of the fastest spreading variants that has been found to date. And these numbers get even more stark and more startling for some portions of our population. And that's the population of children who are now returning to schools, who have been more than likely not in person school, but because of the legislation are being encouraged and pushed to go back to school. And or the Department of Health and Human Services will not, their hands will be tied if there needs to be a closure. And then they are also the ones who are paralyzed right now because the funding is not getting to them to address some of the needs that are in these schools. And this is at a time when the vaccine, we're so happy to see that the vaccine is rolling out. But when we look at the vaccine getting into the arms of our BIPOC, our Black, Brown, Indigenous communities, our numbers are dismal. Only 1.7% of Black African Americans have received their final vaccine. Only 1.7%, 3.5% that has received the initial, and only 1.7% who has received the completion vaccine. That number goes to 0.3% for our Hispanic Latino population and 0.1% for our Native American population. So, though we are making stride, there are some that have been left behind and have not had the access to the vaccine. We also just want to make note that our BIPOC children across this nation, when it comes to adverse impact, 78% of the children who die from COVID, and the number may be low, but we have to look at the fact that many of these children have not been in classrooms, but 78% of the children who die from COVID are African American, Hispanic, Latino, or indigenous. So of our BIPOC community, 78% of the deaths, though they only make up 41% of the population of that age group. Right here in Michigan, when we look at some of the syndrome that we're seeing that is related to COVID, having children having COVID or being exposed to COVID, and that's multi-system inflammatory syndrome, where multiple organs may become inflamed. 50% of the cases that we've seen, again, yes, they are low, but many of our children have not been in the classroom, but 50% have been children that are Black or Latino, and that population is only 25% of the total population under the age of 21. And so, again, I say our schools right now are being paralyzed and unable to move and put steps, mitigation processes in place that could help them to mitigate the factors and the impact of COVID at a most critical time. And I just want to say that according to our government, our Constitution, I should say, our government was built for the purpose of establishing justice and promoting our health and our safety. But right here in Michigan, in the face of the most horrific public health crisis, our government is using our health and, even worse, our children's health and well being as bargaining chips, as tools to negotiate our government and our legislators' power and control, to be able to maintain that power and control. While Michigan is armed with the brightest and most ingenious of minds, our government continues to deny science and refuse to protect our health, our future, and our children. So today, we are here calling on our government, our legislature, to decide today, to tell us today who they are at war with and who are they fighting for. Are they at war with COVID, or are they at war with our children? And so we will hear from Angela Waters Austin next, and then she will introduce Dr. Karen Williams Weaver. Angela is with Black Lives Matter Michigan, and Karen Williams Weaver, former mayor of Flint, Michigan, is the interim director for African American Mayors Association. Tiffany Tilley is here with me, I'm my fellow board member. Ellen Cogan Lipton is here with me, our legislative chair, and served as a state representative. And I believe that we will be joined by a couple of more people, another State Board of Education member. And I should say that I am here speaking as the Vice President of the State Board of Education. I am not here speaking as on behalf of the entire board. So I'm going to turn it over to Angela. Thank you, Angela.
Thank you so much, Dr. Pugh, for your partnership, for your wisdom, for your constant reminder that children have to be at the center of any conversation and any decision making about reopening our schools. As the CEO of One Love Global, our primary focus is youth organizing. So I have a different perspective as a co-founder of Black Lives Matter Michigan. And we have determined that education, economic justice, and environmental justice are the intersections that we embrace and that will guide our work today and going forward. Ensuring children and their family safety must be at the top priority of every adult who is responsible for making decisions about school reopening. Children who are exposed can potentially infect their families and others in their communities. A safe return to school is in everyone in Michigan's best interest. Investing in the safest and highest quality learning should be what state leaders prioritize with COVID relief funds, which requires more than just opening the doors of the school and shoving the children inside the building. Schools that were unsafe before the pandemic are the responsibility of those who control the purse strings and who permitted the inequity between schools and districts to persist for so long. Now is the time for Michigan to rise to the top in education by modeling what an equitable and safe return to school can look like for the nation. We can be leaders in this. I'm so grateful that I have to call former Mayor Weaver, a friend and a sister and a true champion for our children. And with Dr. Pamela Pugh, our two community champions for Michigan's Breathe Act, which puts our children at the center of education policy. And I am just so pleased to invite you to add your remarks.
Thank you, Angela, and thank you, Dr. Pugh. And I do want to say I am so happy to be here with these advocates and these fighters and these voices for our schools and our young people. This is extremely important. But I just want to talk about to reopen safely during COVID-19 pandemic and to maximize the amount of in-person instruction. Schools need sufficient resources. That's what we've talked about. They need sufficient resources as well as adhere to strong state and local public health measures. It's important to note that there are great disparities in which students attend in person versus remote. You know, there's a new study that shows Black students are far more likely to receive only virtual instruction rather than hybrid or in person than white students. You know, in Michigan, 60% of white students attend school in person and only 21% of Black students attend in person. So overwhelmingly, the majority of Black students in Michigan are receiving virtual instruction only. And while, yes, we want kids back in the classroom, but we want them in there safely. That's how we want it, safely. So opening up safely includes having tailored interventions for traditionally marginalized communities. And we know that communities of color are more likely to live in multi-generational households, which means higher exposure rates for older communities when children return to school. We know that Black communities are getting vaccinated at lower rates. You know, there's understandable vaccine hesitancy in Black communities because we've dealt with a racist, exploitative healthcare system for far too long. But as community leaders, as leaders, we have to have these tough discussions on the importance of still getting vaccinated so that the virus doesn't continue to spread and mutate and develop more variants in our communities if we're the last to get vaccinated. Something else we need is consistent implementation of mitigation strategies during all school-related activities. It's critical for reopening schools and keeping them open. That's what we want to do. We want to be able to keep them open. But to that end, the U.S. Education Department released a COVID-19 handbook, which provides strategies to do this and also identifies ways to promote equity for communities of color and people with disabilities, chronic conditions who we know have borne a disproportionate burden of illnesses and serious outcomes from COVID-19. So what are those steps that are needed? Universal and correct wearing of masks, physical distancing, hand washing and respiratory etiquette, cleaning and maintaining healthy facilities, including ventilation improvements. Angela talked about these old buildings we're in, ventilation improvements, contact tracing in combination with isolation and quarantine in collaboration with state, local, territorial, or tribal health departments. And here's something, Accurate, comprehensive data is crucial to combat all public health issues, including COVID-19. It dictates how resources are allocated and what strategies are implemented. And without complete data, the people most in need of help from COVID-19 go ignored. That has to stop. We need data to help guide this decision-making for schools to reopen. Our vaccine rollout is showing these data gaps and inequities even further. You know, many states are not reporting vaccination data by race and ethnicity. And the sliver of data that does exist shows that our nation is falling behind in vaccinations of communities of color, even though they're most likely to get COVID-19 and die from it. You know, we die from this. We need to analyze community data as a first step to determine appropriate in-person learning approaches. And last, districts and school leaders should review levels of community transmission to inform the degree of in-person learning that can proceed, that can proceed safely. So thank you for the opportunity to share my thoughts and have input in this most critical conversation.
Thank you. And Tiffany, we will have you go next. State Board Member Tiffany Tilley.
Thank you so much. Good morning. First, I want to thank Dr. Pam Pugh, my colleague on the State Board, for organizing this very important discussion. This is so needed. I know there are many people that are eager to open the school doors. As State Board members, we know how important education is. As an advocate, I educated parents about the importance of closing the achievement gap for years. I've championed equitable education, and in normal times, our children would be in the classroom. But these are not normal times. We are still in the middle of a pandemic. We are not out of the woods yet. In fact, we are in deeper waters than we were at this time last year. And so we need to trust the data, look at the numbers, trust the epidemiologists. Our children are at risk, at high risk. And as important as their education is, definitely, we don't want to put their health in jeopardy to have them sit in a classroom. Many of them are afraid. Many parents, many teachers are afraid. Our buildings in certain communities have not been equipped to handle what's going on. So we have $1.9 trillion that the federal government has sent to states. And that is awesome. That is going to be an amazing help. We know that these dollars are a one-time help. This is not something that's ongoing, but we know that for right now, it's going to be an amazing help, but they need time to adjust. They need time to get the classrooms and the school buildings in order. And we don't need to push for our kids to be back in classrooms when they're not ready to be, when the schools are not equipped for this yet. And we know because of the data, there were 54 new outbreaks last week in the K through 12 settings because of being in the classrooms and because we're not ready to handle this. This virus is highly contagious. And so we just want to make sure that when our kids go back, they go back and they are safe and that the schools are prepared. I believe that they should still have the options to do hybrid or online virtual learning, and let the schools make the decision. The state shouldn't make the decision. Let the school districts make the decision for what is best for their district. Thank you.
Thank you, Board Member Tilley. And then we will hear from Board Member Jason Strayhorn.
All right. Can you hear me? Can you hear me?
Yes, we can hear you.
Okay. Well, no, thank you for your time, and I really appreciate the topic and Dr. Pamela Pugh reaching out and putting this together, because it's a very important discussion, a very important topic, and something I'm passionate about. To see what is happening with our legislature and the push to reopen schools without looking at the science and as Tiffany just eloquently said, the epidemiologist, it's very concerning to me. You know, when you look at the push to reopen for districts, even in more financially stable areas like Oxford, which has implemented COVID exposure mitigation strategies, it's resulted in over 400 kids infected in the high school level. The Republican effort, in my opinion, to link COVID-19 funding to policies designed to usurp and strip the gubernatorial powers is immoral. It jeopardizes the health of children, their families, educators, school support employees like janitors, bus drivers, secretaries, etc. The attempt to decentralize and shift responsibility for reopening protocols is politically motivated and marginalizes the critical need for a uniform approach to assessing the risk that really lays before us. As cases rise at a rate now being referenced as a potential fourth surge, embracing this proposal, in my opinion, would be disastrous for us all. Holding our children hostage in a political platform to withhold funding that is absolutely needed, I think is deplorable. I think it's something that touches every single family in not only our state, across our great country. I think that the sports is something that is near and dear to my heart, but we have to be smart about doing it. I don't think that the life lessons and the teamwork and all the camaraderie that is taught from those things that I am extremely passionate about is worth losing the life or at the expense of a life of one child or one person. This is something that is very important as far as the ventilation systems. It's a very expensive proposal that has to happen to clean the air in some of the heavily impacted areas. And that's my background in construction, in real estate. These are things that have to be looked at and have to be funded at any cost and every cost necessary in order to save lives. I really appreciate this discussion. I appreciate everyone who's on this call. Again, thank you, Dr. Pugh, for doing this, and Angela Waters Austin. That was a beautiful message you had there. Dr. Karen Weaver, that was outstanding. And Tiffany, my colleague on the State Board of Education, always a pleasure to be on a panel with you. And I would like to turn this back over to Dr. Pugh as she continues on this press conference.
Thank you both for those very strong and impactful words. And we are so happy to be joined by Tashmika, and we will have her to go next if you're okay with that.
Am I just introducing myself? I'm
You're
sorry.
introducing yourself, and you're going ahead and giving your 2-minute spiel.
Great. Thank you so much. My name is Tashmika Torak. I apologize for the delay. I was in a meeting up until the last minute, but thank you for having me. I'm the founding co-director of the Firecracker Foundation. My work is around providing holistic healing to children who have survived sexual violence and their families. I am here today because I really believe that it is our duty to not leave families behind. We know that Black people in particular are dying because of COVID-19. And I want to extend my condolences to so many families who are being harmed through this process. There is a lot to learn from death if we are willing to listen. And in this moment, we can learn how not to leave children behind. We can learn to prioritize children and their lives and teachers and their lives and really move forward in a way that protects them. Life is valuable, And we don't want to lose people who are vulnerable. And we certainly don't want to expand the deficits in our educational system and the ways that we handle racial and ethnic disparities and the ways that people with disabilities are supported in our schools. Our children deserve this year to stay healthy. Our teachers deserve this year to maintain their capacity. Our schools deserve funding to be able to address the crisis that has happened in our communities. And we need to do this in a way that doesn't cause further harm and doesn't increase the spread that will eventually kill so many people, more people than we have already lost. So I would invite our leaders to really stop and take a breath and recognize what our priorities are. We cannot sacrifice the community for the individual, and we cannot sacrifice the individual for the community. And so we really need to move forward in a way that holds most of us, that holds the most vulnerable in particular at the center of the decisions that we are making, because our children deserve better than this. Our children deserve better than this. Our children deserve better than this. And they deserve to survive this situation without impacts to their mental health and their well-being that will last them a lifetime. So I am just here to advocate for them and ask those that are listening to do a better job of thinking about them. Thank you.
Thank you, Tashmika. Thank you. Ellen, if we can have you last but not at all least.
Thank you so much, Dr. Pugh. Your leadership in putting this together and your vision to never stay silent in the face of injustice is an inspiration to me, and it is an absolute honor and privilege to be part of this conversation with all of you. Being in the education advocacy space, as many of you know, can oftentimes be very lonely. And sometimes the other side makes us feel like we're all alone. But it's times like this that we need to remind ourselves that we are not alone. When we link arms and when we speak with one voice, we are powerful. They might have a lot of money, the other side that would would want to destroy public education. They may have the money to throw, but we have the numbers, and we are not alone. And when we stand together and speak with one voice, I do believe that we will win the war. And I don't use that term lightly. I have been in these education wars now for the better part of a decade, beginning with my time in the legislature. This is a battle. This is a war. And the other side, as we can see right now, notably the Senate Republicans, are waging a political battle against the governor. And this is an adult problem, adult squabbling. And as many of the speakers have pointed out, our children are the casualties of this war, and it has to stop. I remember before I ran for office, when I was a young attorney, I would observe sparring parents in divorce mediations. And they would say to me, it's all about the children. I want what's best for the child. And then they would do things that would weaponize their children to score points against their spouse, their divorcing spouse. And when you see that happening, you can recognize that it's wrong. When I got to the legislature, I saw that happening over and over and over again. These legislators that would spout all kinds of platitudes that it's all about the children. I'm doing it all for the children. And it's a lie. It's not the case. It's not about the children. And we can see this type of attitude happening right now. This is a long history of using schools and using the funding of schools to promote a radical and harmful agenda. we can't forget that for 20 and more years in this state, the legislature have been consistently funding schools. And this was intentional, because when you reduce someone to poverty, then when you give them scraps, they'll do whatever you want. So you've got now a situation where the legislature has understood the power of using money to get schools to do exactly what they please, whether or not it's right for the children. And so is it any wonder that schools are scrambling in the face of the money that the legislature refuses to appropriate, to jump through all kinds of hoops, to try to scramble to do the legislature's bidding? And what has the legislature done but thrown families and schools into chaos? As we've heard, there is a right way to send children back to school safely. There is not a person that you've heard from today who does not desperately want kids to go back to school and to try to have somewhat of a return to normal, if we can ever get to that point again. We know that children enjoy being in school, enjoy socializing. We understand that there's all kinds of learning that goes on in schools, and we desperately want that for our kids, but not at the expense of their health and safety, and the safety of their parents and their grandparents. There was a right way to do this, and school districts were on that plan. We say that we believe in local control, and yet the legislature has pulled the rug out once again from local school districts. There were many school districts that were starting to onboard their children into in-person instruction as they were able to manage class sizes, as they were able to manage ventilation and reworking HVAC systems and providing clean drinking water, cleaning up schools that have been allowed to go into disrepair from decades of funding. And we did get this gift from the federal government to allow schools to do the methodical investments that would be needed so that kids could go back to school safely. And what did the legislature do? They do what they've always done. They've used education to weaponize public education, use our children as pawns to get the policy that they want. They wanted kids back to schools. Local school districts knew that it was not the right time, particularly on the brink of spring break, when we know we just have to look on the news and see that kids and families that are traveling on spring break and coming back and bringing highly contagious variants back to their communities. It is not an if, it is a known quantity. We know it's going to happen. And so school districts were waiting for that spring break, hoping to bring kids back after. And what did the legislature do? No, they said, this is what we want. And they did it strictly to weaponize the reopening of schools and to send a message to the governor that they don't like the way that she's handled this pandemic. Well, here's the reality, and you and I both know this. We will not tolerate our children being used as political pawns anymore. We're here today to speak with one voice that we know what the Republicans in the legislature are doing. We're on to them. Now that we have this knowledge, as I've always said, knowledge is power. And together, we are going to speak truth to that power, and we are going to do right by our children and make sure that this type of political weaponization of our children stops right here, right now. Thank you.
Thank you, Ellen. Thank you. And we're gonna just ask if people can put questions in the chat. And if there is any media that is here, and I really hope that there is media that's here, because we need our media friends and those media who's trying to get fact-based information outside of the talking points to get fact-based information out. And we would hope that they would be here at an event such as this, virtual event such as this. So I really would hope that you would put your questions in the chat. And I'm going to trust that there is some media that's here. I just want to also say that we do know, and we have definitely got information, and we're in, of course, contact with our state superintendent for public instruction. And so we will be looking at how some of these bills, the ones that have been passed by the governor, 4048 in particular, which has required schools to go to school by March 22nd. Some of those schools are being threatened to not receive funding if they did not go into the classroom on March 22nd, again, at a time when we've laid out, and many of you have read and know firsthand where we are as far as the third wave of this virus, this public health crisis. We will be talking and determining how the department will play a role in how schools are being coerced into not getting funding if they are being forced to put their children in harm's way. And so we will be following up on that as well. I do see that there is a question we do have some questions, and I also see that we have Tom Padroni, who is a researcher, and I know has been doing some work, and then I'm going to look in the chat for other questions as Tom speaks.
Yes, thank you so much, Dr. Pugh. I'm Thomas Padroni, and I'm an associate professor of curriculum studies and a teacher educator at Wayne State. What I want to share really quickly as a question and comment is about what the panel thinks we should do about the following situation. I realize that DPSCD Superintendent Vitti is under the very pressures that you have outlined here today as a superintendent. However, I'm very concerned about how he's been navigating those pressures, and I'll say what I mean. First of all, obviously DPSCD is the largest district in the state, and it's almost exclusively students of color, majority Black. Here's the situation. On February 24th at a town hall, Superintendent Vitti the town hall was about the return to in-person learning. Dr. Vitti stated that the buildings that were being used for classrooms met CDC guidelines for air exchanges. Over the ensuing few weeks, I asked him how he came to know that. And initially he responded that, well, even though the buildings are old, that doesn't mean they don't have good air exchange. And I said, okay, well, that sounds plausible. But how do you know? How do you know that the air exchange rates meet CDC guidelines? And he finally conceded that those tests won't be completed until mid to late April. So that was on February 24th, when he initially said that they were all meeting CDC guidelines, yet the test won't be done until mid to late April. Now, at the same time, he has been subjecting teachers to a great amount of pressure because apparently, based on what he shares about the safety of going back, 20,000 students apparently want to return, but a much smaller number of teachers. And there's a mismatch. So teachers have been under tremendous pressure to go back in. In fact, at the March 9th meeting of the board, he stated that people who are still questioning safety are unprofessional. And he has highlighted the mismatch in a way that obviously, he's highlighted that teacher's choice is resulting in this mismatch. So here's my concern or question. Obviously you have that. I've brought that data, including the emails from Dr. Vitti, where he states this, to media, and I cannot get any media to respond to me and respond to me at all, let alone look at this as a story that is worth telling. And I know he's under political pressures. I guess the media are as well. but there are there are tens of thousands of students whose lives are in the balance, plus their communities, and Detroit has been hit hard enough. So I guess my question is, how do we strategically respond to an environment where a superintendent is reacting this way to the pressures he's under, and the media is not raising questions that need to be raised?
I'm going to let one of the organizers, one of the real organizers, answer that question. Angela, do you have any points to that? And I will follow up, Tom. I will get with you and I will follow up, and I can see what my board members and I can do if there's any questions. And let me say this. At our last State Board of Education meeting, I did put on our next, that we have to start looking at information of who's in the classrooms. As Mayor Dr. Karen Weaver pointed out, the 21% of children that have not, the majority of children that are most impacted have underlying issues, go to schools where there are risk for exposures, heightened risk for exposures, are the ones that were not in school but now are returning to school. And a lot of that is because there was this push to get students back into the classroom by March 1st. So without the funding that's now being tied up. So we do need to put more emphasis, and Ellen pointed that out, many people did. Our emphasis should not be on a calendar date, but it needs to be on what mitigation strategies have put in place. What is the positivity rate that's circulating in your community? Is the disease widespread? Back a few months ago, that's what we were talking about. You can't put children back in school if the disease is widespread. Somehow that science is forgotten. So we will respond to your question. And Angela, before we discuss the organizing piece, why don't we take, because there are some more media folks that are in here. And so we will follow up with you, Dr. Padroni, on that question that you've posed. And there is, Angela, I don't know if you see them. I think I see, is there a Sherry Hardman from ABC 12? Rachel Just. Do you all want to state your questions, or I can read them? What do you say to people who say that remote learning has caused some students to fall behind in their education, that they need that in-person learning? And I will let someone else respond. I have some thoughts, but I will let someone else respond first.
Go ahead, Ellen.
No, please go first, Tashmika, I'm sorry.
So behind whom? Behind what? And is this a man-made experience? Yeah, we created this problem for our children. It existed before the pandemic because of racial and ethnic disparities. And suddenly it is a crisis to keep our kids all at the same pace. They have never been at the same pace, and they have never been afforded the same educational access. So in this moment, we had an opportunity, and we still have an opportunity, to take a step back and address these inequities in a way that improves all of our children's access.
That is exactly right. People need to understand that this new term learning loss is something that has been fabricated to create a crisis. I saw this a lot when I was in the legislature. The other side does a very good job of creating havoc and crisis, and then coming in and saying, well, we in our eminent wisdom are going to come in and solve the crisis. We need to realize that this is a mess that the other side has created. Yes, we know, and we've said it before, the ultimate goal is to have children in a stimulating, healthy environment with teachers that feel that they are safe and secure, who are given the latitude to exercise their professional skills. And the legislature cannot seem to stop their desire to create these artificial crises, these artificial deadlines, and then force schools to do their bidding. I think that, my observation is that parents and families, when armed with the appropriate information, can be tremendous advocates, but getting the right information can oftentimes be tricky. And so I think that a lot of schools and school districts are responding to a lot of parental aggravation and angst, because we know that this has been hard on families, on working families and what have you. But we know that there's a right way to get kids back to school. And people need to take a step back and realize that these artificial deadlines that are created, these artificial terms like, learning loss, and think of all the things that kids are losing and they've lost, that if we properly fund schools, we properly resource teachers, we give them the support that they need, they will be able to develop individualized plans for students to allow them to be where they need to be and really fulfill their ultimate potential, because that really is what it's all about. It's not about creating these artificial metrics, but it's about giving students the opportunities to really spread their wings and grow.
Hi, this is Tiffany Tilley, State Board Member Tiffany Tilley. In cities like Detroit, the illiteracy rate is at 47%. With the achievement gap, high school students that graduate in urban areas are 4 years behind their counterparts in suburban areas. So that means when somebody is graduating from high school in a city like Detroit, it's like they're an 8th grader in comparison to their counterparts in the suburbs. We have had some serious issues in education in the state of Michigan. MDE has developed a top 10 and 10 plan that as board members, we fully support and have been pushing. I hope that the people that are pushing this learning loss theory as if it's something new, that there's some type of serious issue that's new in education, remember equitable funding, remember to make things equitable after the pandemic is over. Right now, we are in a state of crisis. We want all of our children to be educated. We want all of our children to have access and opportunities. Right now, we also want our children to be healthy and to be safe. Thank you.
Yeah, you know what, and I just have to say something really quickly, because I don't remember us ever saying we didn't want our kids in school. We never said that. We said we want them there safely, in a safe environment. I don't want to send my child to school and they're going to get worse. I don't want them to bring something back to me and I'm going to die. We need to do things in a way that makes sense, where we're putting the public health and well-being of everybody first. That's what we've talked about. We've talked about tailoring things specific to the school and to those kids and what they need there. That's what we've talked about. I haven't heard one person say, I don't want my child to go to school. We said we want them to be able to have these learning experiences in an environment that is conducive to learning, and they will be safe and everyone will be safe. And that's what this is about. It's the safety of our kids and of our communities.
Thank you. And I just want to echo all of that. Learning loss is a lie. It's as big a lie as election fraud. And it's not a coincidence that these things come from the same source, the same people who would deny that COVID exists, that people are dying of COVID, reject science and wisdom in every other sector. So this is not a coincidence and it's not isolated. And I also want to say that it's a lie because I can say firsthand over the past year of working with young people in our youth organizing. When we had to figure out how to switch and make the transition to taking all of our programming online, we consulted with the students. We held a 2-week workshop where they actually helped us build a digital platform that would make them feel welcome and safe and where they could continue to grow and thrive. They created a learning program that actually got them a chance to experience the world, to understand how decisions are made that impact their lives, to actually develop the skills and the voice to be able to advocate for themselves. So absolutely, Tom Pedroni, this is an organizing issue. The voices that we don't hear are the directly impacted students, the directly impacted parents, and the directly impacted teachers. And there's a reason that those voices get silenced. But by and large, they're the largest voices. So we have a small number of people, a minority of people who don't have that experience, who are making decisions on behalf of people who they haven't bothered to listen to, who haven't bothered to care about their lives, and who have really begun to erase the parents who and the teachers who have worked so hard to make sure that there is consistency and love and care in the midst of a pandemic, in the midst of a global uprising and reckoning of white supremacy, which is what this conversation is about. It is time for Michigan to reckon with the racial inequities that created the harm that has persisted in our communities, that actually creates the higher risk for Black and Brown families. That risk didn't just happen, it was created. It was a man-made risk based on people's decisions that do not factor in the consequences. And the conversation that we're having is not just about Black and Brown children. It's about all children in Michigan. Because as surely as a Black and Brown child will bring a pandemic, bring a virus home, a white child will bring a virus home. So we're thinking ahead for everyone's sake, because we don't want anyone grieving and mourning the loss of their children and regretting the choices that they made because they thought a letter grade or a trophy or a scholarship was more important than their children's lives. We don't want anyone to have to live with the guilt and the pain of having made a decision that cost them the most sacred and most valuable person in their lives. We can do things differently. We saw children rise to the occasion and become creators and innovators, and to actually build what we can't seem to figure out as an adult. Work with our students, work with our parents, work with our teachers to build a system that works. We have to reimagine education in the same way that we have to reimagine policing. Going back to the old way is not what our children need. We need to create a new way that works for everyone.
Thank you, Angela. And we do have another question. And I just want to mention that I spoke with a superintendent today, and their answer to that question is simply stop playing games with our money, stop warring with our children. The money that they are holding up is the money that's going to pay for the so-called learning loss that's being talked about. How do they talk about putting in technology, putting in special helps? If there is if they do decide to do summer school, that money is tied up. And with the money that's tied up from 3 months ago that was released under the Trump administration, we also have the American Rescue Plan dollars that we also don't know if they're going to be subject to this type of game playing that's going on as well. But what we say to that is stop playing games with our children and release the funding. And so there is another question from Rachel Louise, so with Channel 3. Have you met with lawmakers to talk about your concerns, and have they been open to hearing what you have to say? And Ellen, I'm going to pitch that to you, our legislative chair for the Board of Education.
Yes, as a former legislator, I have had a number of conversations, and I don't want to blanket the legislature as one big problem. And I do want to place the problem squarely on the shoulders of the Senate Republicans. I have had conversations with lawmakers who have approached me, again, as a former legislator, in terms of what can we do to impress upon the Senate Republicans that we cannot use our children as political weapons. Unfortunately, those pleas have fallen on deaf ears. And I think that it's abundantly clear to me at this point that the majority leader over in the Senate is interested in nothing short of using the school funding issue as a political weapon against his own personal fight with the governor and the way that she has handled the pandemic. This is his way of punching back at her. I think at one point he even had the audacity to threaten her to a fist fight. But this is the equivalent of a legislative fist fight and battle that he is waging with the governor over his feelings of how she has handled the pandemic. And he's drawn his line in the sand.
I mean, can we also just name for 1 second that during a global pandemic where we are seeing deaths by the day, that we have to go to elected officials and ask them to not allow us to die? Like that we have to ask permission to remain healthy, that we have to ask permission to prioritize people who are the most vulnerable? I would like to know if they've met with us. Because honestly, at this point, the information is readily available. It's not an issue of not knowing. It's not an issue of not having access. We are talking about the people who have the most access to the most information and have the most power to impact our lives during a global pandemic. And they are choosing willfully to not only do harm to our children, but to do harm to our entire community. They are outside of the social contract. They are outside of their due diligence and their duty. And we are responding. We are doing our best in our own community to protect ourselves and to protect our people, and to ask other people to continue to do that work as well, because we have to turn to our own communities to protect ourselves with our own resources, because our political leadership is playing games not only with our money, but with our livelihood. This is outside of what we should be asked to do, what we should be tasked with during this time. My children are currently in my home right now. I am one of the parents that we're talking about. And I'm supposed to find time to meet with our legislature? Like, why? Why would I do that? Why are they not already making these decisions? And I am also would like to lift up the fact that the issue did not start down here with my community. We've had these issues for so long, and there are people way up the river that are dumping their trash in our river, that are polluting our river. We are just trying to live. And so I just would like to invite members of our community, members of the political sphere, to look up at where this problem was caused and to address those institutional and systemic issues that have brought us to this impasse, so that we never have to have these conversations again, because honestly, we shouldn't be having them right now as it is. This is not what we should be doing. We are a target. And I would like to remove our people from the center of the bullseye, please. And thank you.
Can I just say thank you, Tajmika, for saying that? No, we shouldn't have to ask, but we have to. We have to demand. If I didn't learn anything from the Flint water crisis, I learned that we shouldn't be asking for a lot of things. We are still asking for and begging for, and it's falling on deaf ears. So we do. It's sad. It's a sad state when you have to go to your elected officials and talk to them about the importance of the health of a community, about the health and well-being of people. And profit is always put over the health and well-being of us. And I just had to say thank you for saying that, because no, we shouldn't be here asking for, have we gone to them? They ought to protect us and to serve us and to speak up for us. And we don't see it happening. And so I have to say thank you to all of you, Dr. Pugh, for putting this together, because once again, we have to have a platform to make our demands heard. And we are going to continue to put demands in place when it comes to the health of our community, to the health of our children. So I'm just happy to be here with all of you to have this conversation that we shouldn't have to have.
Absolutely. Are there any other last words? There is, as you all are getting that together, and we're closing this out, we're running a little over, from Patrick Rose. There are school districts requiring students to return to face-to-face in-person classrooms without allowing medically vulnerable students' families to have a remote online option. Is this legal? Doesn't the school have a duty to accommodate requests for online schools? And then another one, is there funding to increase testing in school of students and staff? And so there should be funding for increased testing. I don't have the direct answer for that. And Ellen, were you gonna answer one of the questions?
Yeah, so the second question, the category of funding that that the bulk of this money is coming from is Title I, and under the language of the federal language, yes, school districts were given broad latitude in very broad categories to spend that money, and testing is one of those areas. Unfortunately, that particular line item was tie barred to a provision that the governor vetoed, and so the concern is that if the governor, through executive action, hypothetically, sends that money out, that the majority leader has already threatened a lawsuit, and has actually asked the legislature for, I think, a couple $100,000 in an appropriation to sue the governor if she tries to send that money out without the legislature's approval. So that is those types of dollars for testing is really at the eye of the storm, amongst other line items of money as well. Some has been released, that we know. Some has been released, but not all of it. And much of the money that could be used for some of these rapid tests is unfortunately in legal limbo right now. In terms of the other question, which I believe involved providing mandatory providing of online learning for students with disabilities. I mean, I will say, if there's one thing that we've learned during this crisis, is that schools are very adept, if they're given the proper resources and tools, at providing and being very, very inventive about the options for students with disabilities. The issue really under the Individual with Disabilities Education Act is what is written in the IEP. And so if the IEP does mandate online instruction as the best mode of instruction for the student with disabilities, then the law does require the school district to provide that. And again, with added resources and the ability to spend those resources, the school districts would be able to upgrade their technology, do all of the types of technological upgrades that we would like, particularly our economically disadvantaged schools, to be able to do. We want every school to be able to have the resources to provide the best learning opportunities for all of their students, clearly.
And so were there any other closing words that we wanted to have before we close out? We're like 10 minutes over.
I would just like to invite students and parents and teachers to reach out to us. That organizing question is so important. And Tom, I definitely look forward to following up with you. We are here for you. We will show up with you. Let us know how we can support you and making sure your voices are heard.
Thank you.
I would just like to add that we are having this question. We are all holding this question around who gets to be safe during this time and who is sacrificed on the backs of other people's safety. And I would invite people to really sit with that question as they're asking schools to reopen, as they're pushing things forward before COVID-19 is actually under control and over, because we all deserve safety. And no one should be thrown away during this time. You know, we need to really hold one another close. That is a value, our community, you know, that we need to hold our elders close and protect our children and protect those that teach our children. And we have an opportunity to really do that right now. So let's like lean in and figure that out instead of trying to push politically to do things that are harmful to our community. I believe that that is a possibility. I believe that with imagination, we can do that. We can do that. We've done it before. So let's try to figure that out in this time of crisis. Thank you.
Thank you. And Board Member Tilley, did you have any closing words before we close out?
I just want to thank you again for leading this charge and bringing us together. I really do hope that people will concentrate more and be as passionate about equitable funding and creating equitable opportunities for our children statewide going forward as they are pushing it, you know, during the pandemic. And I do want to say again, this effort that is being led by the state should not be led by the state. Districts should have the right to make their own decisions. They know what's best for their district, what's going on with their students, with their teachers. And every district is going to be different. Every district will have needs that they have that other districts don't. The state cannot determine what's best for every single district. Give them the autonomy to make decisions about what's best for their school as far as in-person learning or virtual learning. Thank you.
Thank each and every one of you. I truly appreciate the attendees that are here. We thank our teachers, we thank our parents, we thank our educators, and we thank the media who was here today. We really do appreciate that. And these warriors that are here with me, we are standing firm, and we are standing for our children. We are standing for our teachers, and we want this legislature to answer, who are they at war with? And we will not stand for them to use our children as bargaining chips to maintain their power, again, at the expense of our children's health and safety and well-being. And I will just speak for one of the educators that I spoke to today. Stop paralyzing us. Stop paralyzing our teachers. If you're worried about health, mental health, social well-being, and a learning loss, let the funds go and make sure that the decisions that are being made about our health and pause orders are put in the right hands. I just want to say this is that our local health departments have stepped up, and they've said themselves that that would not be in the best interest of the health of communities. I mean, we want to stop the coercive attempts to push people to reopen. And so with that, again, we thank each of you, and we will continue to band together and fight this issue of injustice that is happening against our children. So thank you.